Question 1. A patient presents with shortness of breath. The physician performs a complete history and physical examination, orders a chest X-ray and dictates the assessment. Acute systolic, congestive, heart failure. Which ICD-10-CM code is assigned for the primary diagnosis? A. I50.30. B. I50.21. C. I50.22. D. I50.9. Answer. B. I50.21. This question tests the application of ICD-10-CM codes for congestive heart failure, where the key terms are acute systolic failure. The ICD-10-CM code I50.21 specifically captures acute systolic, congestive, heart failure, distinguishing it from chronic or unspecified types, which is crucial for accurate clinical data capture. For example, if the documentation mentioned only chronic, systolic heart failure, the code would be I50.22 instead. The ICD-10-CM classification system requires coders to find the most specific code that fully describes the condition documented by the provider. The takeaway tip is always to verify the type and temporal nature, acute, chronic, or acute on chronic, of heart failure to select the correct I50 subcategory. Question 2. A 67-year-old male with a history of COPD is seen for a routine office visit. The physician assesses the patient, confirms the diagnosis of COPD with acute exacerbation, and adjusts the medications. The documentation meets the requirements for a Level 3 established patient office visit. What is the correct coding for this encounter? A. 99213, J44.9. B. 99213, J44.1. C. 99203, J44.1. D. 99214, J44.9. Answer. B. 99213, J44.1. This scenario tests both E/M coding and accurate ICD-10-CM coding for chronic obstructive pulmonary disease, COPD. The keywords are established patient office visit, 99,213 to 99,215, and COPD with acute exacerbation, J44.1. An established patient visit coded at Level 3 is 99,213, and the ICD-10-CM code J44.1 must be used when COPD is documented with an acute exacerbation. Coders must select the most specific ICD-10-CM code, as J44.9 is for unspecified COPD, which would be incorrect here. Remember that an acute exacerbation is a common key term in respiratory coding that requires a more specific code than the unspecified chronic condition. Question 3. A physician performs a therapeutic aspiration of a pericardial effusion, cardio-centesis, using a subxiphoid approach under fluoroscopic guidance. What is the correct CPT code for this procedure? A. 33010. B. 33015. C. 33,011. D. 33,020. Answer. B. 33015. The concept tested here is CPT coding for cardio-centesis, which is the removal of fluid from the sac around the heart, pericardium. Key documentation elements are therapeutic aspiration and fluoroscopic guidance. The CPT code 33015 is specifically designated for cardio-centesis performed with imaging guidance, such as fluoroscopy or ultrasound. Since imaging guidance is documented, the more basic code 33010 without imaging guidance is inappropriate, illustrating the necessity of precise reading. For example, if the report only stated that the doctor inserted a needle to drain the fluid, you would use 33010. Always look for documentation of imaging guidance, as it often determines which of the sequential codes is correct. Question 4. A patient undergoes an echocardiogram to evaluate the structure and function of the heart. The study includes spectral Doppler, color Doppler, and a complete TTE, transthoracic echocardiogram, procedure. The physician writes a final report that interprets the results. What is the correct CPT code for the complete service? A. 93,303. B. 93,307. C. 93,308. D. 93,325. Answer B. 93307. This question tests the coding of a complete transthoracic echocardiogram, TT, which is an ultrasound of the heart. The keywords complete TT, spectral Doppler, and color Doppler all point to the code for a comprehensive study. CPT code 93307 represents the complete TT study, including all necessary components such as 2D M-mode and Doppler evaluations, along with the professional interpretation. If the documentation only supported a limited study, then 93308 would be selected, making the extent of the study critical. The takeaway tip is to verify if the echocardiogram performed was a complete or limited study to ensure correct code selection between 93307 and 93308. Question 5. A 55-year-old patient with a history of primary hypertension presents for an annual physical examination, preventive visit, and is stable. The hypertension is addressed during the exam with medication refills. How should the hypertension be coded in ICD-10-CM for this encounter? A. I10. B. Z00.00 I10. C. Z00.00 I10, Z79.899. D. I10 Z79.899. Answer A. I10. The concept here involves the correct ICD-10-CM coding of a chronic condition managed during a preventive medicine visit. When a routine annual physical, Z00.00, is performed and a stable chronic condition like primary hypertension, I10, is addressed only with routine management, the ICD-10-CM official guidelines state that the chronic condition is coded secondary to the Z code. However, the primary code being asked about is the hypertension itself. The code I10 is for essential, primary, hypertension, which is the correct diagnosis for the condition. Do not code the Z code unless the entire scenario is requested. And remember that when a patient is seen for an annual exam, the Z code for the exam will be primary, and the I10 code will be secondary to indicate the coexisting condition. Question 6. A physician performs a diagnostic right heart catheterization including a cardiac output measurement. The catheter is inserted via the femoral vein. What is the correct CPT codes for this procedure? A. 93,451. B. 93,453. C. 93,452. D. 93451-93561. Answer A. 93451. This question tests the CPT coding for cardiac catheterization, specifically a right heart catheterization with cardiac output. The keyword right heart catheterization typically corresponds to the 93451 code family. CPT code 93451 is defined as a right heart catheterization, which includes the measurement of cardiac output, meaning you do not report the cardiac output separately. The code 93453 is incorrect because it represents a combined right and left heart catheterization, and 93561 is a bundled add-on code for cardiac output that is not reported separately when performed with a complete diagnostic catheterization. Always remember the CPT codes for catheterization procedures are comprehensive and include standard elements like cardiac output measurement. Question 7. A patient with severe coronary artery disease, CAD, undergoes a coronary artery bypass graft, CAB, procedure using a venous graft for 2 coronary arteries and an arterial graft for 1 coronary artery. What CPT codes should be reported? A. 33511 33533. B. 33533 33518. C. 33512 33533. D. 33534. Answer C. 33512 33533. This scenario addresses the complex CPT coding for coronary artery bypass graft (CAB) surgery, which requires separate codes for venous and arterial grafting. The key is to count the total number of venous grafts 2 and arterial grafts 1 separately. Code 33512 is used for 2 venous grafts, while 33533 is the add-on code used to report the additional arterial graft, such as an internal mammary artery. When both graft types are performed, the CPT guidelines require reporting the appropriate venous graft code, 33510 to 33516, and the arterial add-on code, 33533 to 33536. Remember, arterial grafts are always reported with an add-on code in addition to the base venous procedure code, even if a venous graft was not used. Question 8. A patient is diagnosed with a spontaneous pneumothorax. The physician performs an initial insertion of a chest tube thoracostomy to drain the air from the pleural space. What is the correct CPT code? A. 32551. B. 32557. C. 32554. D. 32555. Answer: D. 32555. This question tests the coding for chest tube insertion, specifically for drainage of air, pneumothorax. The keyword is initial insertion of a chest tube, thoracostomy. CPT code 32555 is designated for the initial insertion of a chest tube for drainage of air or fluid, done using a tube or trocar. If the chest tube insertion was performed under imaging guidance, the code would be 32557, so the technique is a crucial detail. For example, if the doctor used a small catheter with a guide wire, the correct code would be 32556 or 32557, depending on whether imaging was used. Pay close attention to whether the insertion is initial or subsequent, and whether imaging guidance was used, to select the most appropriate code from the range. Question 9. A patient is admitted to the hospital with an acute STEMI, ST elevation myocardial infarction, of the inferior wall. He has a history of NIDM, non-insulin-dependent diabetes mellitus. What are the correct ICD-10-CM codes? A. I21.3, E11.9. B. I21.9, E11.9. C. I21.3, E11.69. D. I21.3, E11.9, Z86.74. Answer: A. I21.3, E11.9. This question tests the accurate assignment of ICD-10-CM codes for an acute myocardial infarction, MI, and a coexisting chronic condition. The keywords are acute STEMI, inferior wall, and NIDM. The specific code for an acute inferior wall STEMI is I21.3, which must be coded first as it is the reason for the admission. The coexisting type 2 diabetes, NIDM, is coded with E11.9, type 2 diabetes mellitus without complications, as no complications were documented. Remember that if a patient has an MI that occurs within the 4-week time frame from the initial event, a subsequent MI code would be used instead. The takeaway is that the MI code takes precedence over the chronic diabetes code because it is the acute condition and reason for the encounter. Question 10. A 72-year-old patient with an existing dual-chamber permanent pacemaker has the pulse generator replaced. The leads are confirmed to be functioning correctly and are reused. The procedure is performed in the hospital outpatient department. What is the correct CPT code for the pulse generator replacement? A. 33228. B. 33233. C. 33230. D. 33213. Answer: B. 33233. This question assesses CPT coding for the replacement of a permanent pacemaker's pulse generator, often called the battery. The keywords are existing dual-chamber permanent pacemaker, and the generator is replaced. CPT code 33233 is specifically for the removal of the permanent pacemaker pulse generator only, and removal is inherent in the replacement procedure when the existing leads are kept. Code 33228 is incorrect as it is for the insertion of a new pacemaker, not just the replacement of the generator. The procedure involves removing the old generator and inserting a new one, but only the generator replacement code is necessary as the removal is included. Always check the CPT guidelines to ensure you are coding a replacement, insertion, or removal correctly, as they are distinct procedures. Question 11. A 45-year-old patient undergoes a treadmill stress test with electrocardiogram monitoring only, no imaging. The physician is present to supervise the test, interpret the results and write the report. What is the correct CPT code for the complete service? A. 93016. B. 93018. C. 93015. D. 93017. Answer: C. 93015. This question tests CPT coding for cardiovascular stress testing, where the keyword clue is treadmill stress test with electrocardiogram monitoring only. CPT code 93015 represents the complete service, professional and technical components, for a cardiac stress test performed without myocardial imaging. If the physician only supervised the test, 93016 would be used, and if only the interpretation and report were done, 93018 would be used. The full service code 93015 correctly accounts for the supervision, tracing, interpretation, and report. Remember that when the physician performs the entire service, including professional and technical work, a single global code like 93015 is used. Question 12. A patient presents with a cough and fever. The physician diagnoses the patient with streptococcal pneumonia. What is the correct ICD-10-CM code? A. J18.9. B. J15.4. C. J12.89. D. J18.1. Answer B. J15.4. This question requires the specific ICD-10-CM code for pneumonia caused by a known organism. The key documentation is streptococcal pneumonia, indicating the causative organism is Streptococcus. The code J15.4 specifically identifies pneumonia due to Streptococcus, contrasting with J18.9, which is for unspecified organism pneumonia. For example, if the documentation only stated pneumonia, the unspecified code J18.9 would be correct. Always seek documentation of the specific organism, bacterial, viral, fungal, etc., to ensure the most accurate code assignment in the J12-J16 code range. Question 13. A 62-year-old male is admitted for management of a hypertensive emergency. The principal diagnosis is documented as hypertensive crisis, defined as a malignant hypertension. What is the correct ICD-10-CM code? A. I10. B. I11.9. C. I13.9. D. I10.0. Answered: D. I10.0. The concept tested is the accurate ICD-10-CM coding of severe hypertension types. The key documentation is hypertensive crisis, defined as malignant hypertension. Malignant hypertension is classified under the I10 code category but is specifically designated by the subcategory I10.0. Hypertensive crisis often falls into accelerated, malignant, or essential categories. Therefore, the most specific classification is required. An essential hypertension diagnosis would only use I10 without a decimal. The takeaway is to remember that the different types of hypertensive crises, accelerated, malignant, or essential, have unique codes within the I10 category. Question 14. A cardiologist performs a percutaneous transcatheter placement of an intracoronary stent in the left anterior descending LAD coronary artery without atherectomy. The patient has no prior stents in this vessel. What is the correct CPT code for this procedure? A. 92928. B. 92933. C. 92920. D. 92928 92929. Answer A. 92928. This question tests the CPT coding for a percutaneous coronary intervention (PCI), specifically stenting without atherectomy. The keyword is placement of an intracoronary stent in the LAD. CPT code 92928 is the code for the initial placement of a stent in a coronary artery, excluding the use of atherectomy. Code 92929 is an add-on code used for treating additional vessels, which is not applicable here as only one vessel was treated. Remember that the codes for PCI are distinguished by the technique used, e.g. balloon angioplasty, stenting, atherectomy, and whether it's the initial vessel or a subsequent vessel. Question 15. A physician performs a diagnostic bronchoscopy with a transbronchial lung biopsy and brushes the mainstem bronchus for cytology in a single session. What are the correct CPT codes? A. 31622 31628. B. 31625 31628 31622. C. 31628 31623. D. 31625 31628. Answer: C. 31628 31623. This question tests the CPT guidelines for coding multiple procedures performed during a single fiber optic bronchoscopy. The key procedures are a transbronchial lung biopsy and brushing for cytology. CPT code 31628 is for the transbronchial lung biopsy, and 31623 is for the bronchial brushing for cytology. According to CPT rules, when multiple distinct procedures are performed through the same scope, both are reported, with the more extensive procedure, 31628, often listed first. The diagnostic bronchoscopy, 31622, is always bundled into the more complex, therapeutic or diagnostic procedures performed through the scope. Always remember to separately report distinct procedures during a single endoscopy unless the CPT instructions state they are included. Question 16. A patient is scheduled for a bilateral total lung lobectomy for malignancy. Before the surgery begins, the patient develops severe respiratory distress and the surgery is cancelled. The patient is sent to the ICU. How is the cancelled procedure coded? A. 32,480 to 74. B. 32,480 to 53. C. 32,480 to 52. D. No code reported, only E/M. Answer: B. 32,480 to 53. This question tests the proper use of CPT modifiers for surgical procedures that are discontinued. The keyword is surgery is cancelled after the patient was prepared and taken to the operating room, implied by scheduled for eighth lobectomy and the immediate transfer to the ICU. CPT modifier -53. Discontinued procedure is used when a planned procedure requiring anesthesia is terminated after the patient has been prepared but before the procedure is complete. Modifier -74 is used for ASC or hospital outpatient settings. For example, if the patient only refused the surgery before being prepped, no code would be reported. The takeaway is to use modifier -53 only for procedures discontinued after the patient is in the operating room or treatment room and before completion. Question 17. A patient with severe uncontrolled essential hypertension and stage 4 chronic kidney disease (CKD) is seen for evaluation. What is the correct ICD-10-CM coding sequence? A. I10 and 18.4. B. I12.9 and 18.4. C. I12.9. D. I13.10 and 18.4. Answer: B. I12.9 and 18.4. This scenario tests the correct sequencing and coding of hypertension with a chronic kidney disease (CKD) complication. The keywords essential hypertension and stage 4 CKD point to the combination code I12.9, which represents hypertensive chronic kidney disease. According to ICD-10-CM guidelines, the combination code I12.9 is coded first, followed by the code for the specific stage of CKD, and 18.4 for stage 4. If the documentation mentioned hypertensive heart and kidney disease, the I13 category would be used instead. The takeaway is that hypertensive CKD requires a combination code from the I12 category, followed by the specific N18 code for the CKD stage. Question 18. An 8-year-old patient is seen in the office for shortness of breath and wheezing. The physician diagnoses acute exacerbation of moderate persistent asthma. What is the correct ICD-10-CM code? J45.50. B. J45.42. C. J45.51. D. J45.909. Answer: C. J45.51. This question tests the coding of asthma based on its severity and state of exacerbation. The keywords are moderate persistent asthma and acute exacerbation. The ICD-10-CM classification for asthma, J45, requires a code that identifies both the severity, intermittent, mild persistent, moderate persistent, or severe persistent, and whether an exacerbation is present. Code J45.51 correctly represents moderate persistent asthma with an acute exacerbation. If the exacerbation were not acute, J45.50 would be the correct code. Always look for the specific combination of severity and state of control or exacerbation to code asthma accurately. Question 19. A cardiologist performs a cardioverter defibrillator, AICD, replacement procedure. The physician removes the existing dual-chamber AICD generator and implants a new dual-chamber AICD generator, leaving the existing leads in place. What is the correct CPT codes? A. 33241 33249. B. 33264. C. 33244 33264. D. 33249. Answer. D. 33249. This question tests CPT coding for the replacement of a permanent implantable cardioverter defibrillator, AICD. The keyword is replaces the existing dual-chamber AICD generator. CPT code 33249 is the comprehensive code for the replacement of an AICD pulse generator, which includes the removal of the old generator. Code 33244 is only for the removal, and 33264 is for the insertion of a new one. The replacement code is sufficient and should be used instead of the separate removal and insertion codes, according to CPT guidelines. The takeaway is that for generator replacements, always look for the single, comprehensive replacement code that includes both removal and insertion. Question 20. A physician orders a cardiac MRI with contrast for a patient to evaluate for myocarditis, inflammation of the heart muscle. The cardiologist interprets the images and dictates the report. What is the correct CPT code for the complete service? 75557. B. 75558. C. 75559. D. 75561. Answer. A. 75557. This question is about CPT coding for magnetic resonance imaging MRI of the heart. The key documentation is cardiac MRI with contrast. CPT code 75557 is for a cardiac MRI without stress testing, where contrast material is administered, and it includes both the technical and professional components. If no contrast were used, 75558 would be the correct code. For example, if the doctor only dictated the report, the professional component code would be 75563. Always differentiate between MRI without stress and MRI with stress, as well as the use of contrast, to select the correct code from the 75557 to 75565 range. Question 21. A patient is seen for a follow-up after an acute myocardial infarction, MI, that occurred 3 weeks ago. The patient has no symptoms today, and the physician documents post-acute MI status. What is the correct ICD-10-CM code for the current encounter? A. I25.2. B. I21.9. C. I22.9. D. Z86.74. Answer. B. I21.9. This question tests the ICD-10-CM guidelines for reporting a recent myocardial infarction, MI. The key detail is that the MI occurred 3 weeks ago, meaning the patient is still within the 4-week window of the initial acute event. Therefore, the acute MI code I21 must still be used, not the old MI code I25.2 or the personal history code Z86.74. Since the exact location of the MI is not specified, I21.9 is the most appropriate code for an unspecified acute MI. Remember that the acute phase of an MI is considered to be 4 weeks or less from the initial event, which dictates the use of the I21 category. Question 22. A patient with pleural effusion is treated with a thoracentesis, needle aspiration, under ultrasound guidance. The physician aspirates 1,200 cubic centimeters of fluid. What is the correct CPT code? A. 32554. B. 32555. C. 32557. D. 32556. Answer: D. 32556. The concept tested here is CPT coding for thoracentesis, focusing on the distinction between imaging guidance and non-guidance procedures. The keywords are thoracentesis, needle aspiration, and ultrasound guidance. CPT code 32556 is specifically used for the initial thoracentesis when performed with imaging guidance. The volume of fluid, 1,200 cubic centimeters, is irrelevant to the CPT code selection. If the procedure was performed without imaging guidance, code 32554 would be appropriate. Always look for documentation of imaging guidance, as it shifts the coding from 32554 to 32556 or 32557. Question 23. A patient is receiving mechanical ventilation, initial day, for acute respiratory failure. The physician provides critical care services for a total of 105 minutes. How should the physician services be coded for this encounter? A. 99291, 99292x2. B. 99291, 99292. C. 99291, 99292, 99221. D. 99291, 99292x3. Answer: A. 99291, 99292x2. This question tests the proper CPT coding and calculation for critical care time. The key time spent is 105 minutes of critical care. CPT code 99291 is used for the first 30 to 74 minutes of critical care, and the add-on code 99292 is used for each additional 30 minutes. Since 105 minutes is 74 minutes, 99291, plus 31 minutes, the physician performed one initial unit, 99291, and two additional units, 99,292x2. The remaining 31 minutes exceeds the 30-minute threshold for the first add-on code, and the subsequent 30-minute threshold for the second add-on code. 75 to 104 minutes equals 1 unit. 105 minus 134 is equal to 2 units. The takeaway is that critical care time must be carefully calculated using the exact CPT time ranges for 99291 and the add-on code 99292. Question 24. A patient undergoes an electrophysiology EP study with intracardiac recording, his bundle recordings, but without attempted ablation or pacing. What is the correct CPT code for this diagnostic service? A. 93618. B. 93619. C. 93620. D. 93600. Answer B. 93619. This question tests CPT coding for a comprehensive diagnostic electrophysiology EP study. The keyword is electrophysiology EP study with intracardiac recording. CPT code 93619 is the comprehensive code for a complete diagnostic EP study, which includes programmed electrical stimulation and pacing, and the use of up to 3 diagnostic catheters. Code 93618 is only for the His bundle recording portion of a study. Remember that an EP study is used to diagnose heart rhythm problems, and the complexity determines the code, with 93619 representing the complete diagnostic service. Question 25. A 40-year-old smoker is diagnosed with chronic bronchitis with emphysema. What is the correct ICD-10-CM code combination? A. J44.9 F17.210. B. J43.9 J42. C. J44.1 F17.210. D. J44.9. Answer: D. J44.9. This question assesses the ICD-10-CM coding for chronic obstructive pulmonary disease (COPD) when both bronchitis and emphysema are documented. The key terms chronic bronchitis with emphysema are collectively classified under COPD. According to the ICD-10-CM guidelines, when chronic bronchitis and emphysema are both present, they are generally coded as COPD, represented by code J44.9 for unspecified COPD. The distinction between chronic bronchitis J42 and emphysema J43.9 is typically resolved by using the combination COPD codes when both conditions are documented. Do not code the smoking history, F17, as a primary diagnosis for this scenario. Question 26. A physician performs a diagnostic cardiac catheterization involving selective catheter placement in the left and right coronary arteries, with supervision and interpretation of imaging. What is the correct CPT code for the selective coronary angiography, excluding the catheter placement? A. 93,454. B. 93,458. C. 93,459. D. 93458, 93460. Answer B. 93458. This question tests the CPT coding for a diagnostic left heart catheterization focusing on the coronary angiography component. The key procedures performed are selective catheter placement in the left and right coronary arteries with interpretation. CPT code 93458 represents the selective catheter placement in the coronary arteries for angiography, and it includes the injection procedure and imaging supervision and interpretation. This code is the correct one for the diagnostic selective coronary angiography component of a left heart catheterization. The code 93459 is incorrect as it represents an even more complex study that includes a left ventriculography. Question 27. A patient with atrial fibrillation, AFib, is treated with a transcatheter ablation of the pulmonary veins to correct the arrhythmia. What is the correct CPT code for this procedure? A. 93,650. B. 93,653. C. 93,656. D. 93,655. Answer C. 93656. The concept tested here is CPT coding for complex cardiac ablation procedures for arrhythmias. The keyword is transcatheter ablation of the pulmonary veins to correct the arrhythmia, which is the specific procedure for atrial fibrillation, AFib. CPT code 93656 is designated for a comprehensive EP study with transcatheter ablation of the pulmonary veins, often referred to as an AFib ablation. Code 93653 is for supraventricular tachycardia ablation, which is different from AFib ablation. Always confirm the specific type of arrhythmia and the precise anatomical location of the ablation to select the correct complex ablation code. Question 28. A physician performs an operative thoracoscopy with wedge resection of a lesion on the upper lobe of the right lung. What is the correct CPT code? A. 32,663. B. 32,666. C. 32,668. D. 32,650. Answer A. 32663. This question tests CPT coding for a thoracoscopic surgical procedure, VATS. The keywords are operative thoracoscopy and wedge resection of a lesion. CPT code 32663 is specifically for a thoracoscopy with wedge resection of the lung. The location, upper lobe, is included in the description but does not change the code. If the procedure was an open surgery instead of a thoracoscopy, a code from the 32480 series, lobectomy, would be appropriate. Remember that VATS procedures, video-assisted thoracic surgery, which uses a scope, are found in the 32,661 to 32,674 range. Question 29. Which CPT code is used to report a routine EKG/ECG, electrocardiogram, with 12 leads when only the interpretation and report are provided by the physician? A. 93,000. B. 93,005. C. 93,010. D. 93,040. Answer C. 93010. This question assesses the CPT codes used for different components of a routine electrocardiogram, EKG/ECG. The key phrase is only the interpretation and report are provided. CPT code 93010 is designated for the professional component of the EKG, which includes the physician's interpretation and written report. Code 93000 is the global code, technical and professional components, and 93005 is the technical component only, tracing. Always determine if the physician performed the complete service, just the tracing, or just the interpretation and report to choose between 93000, 93005, and 93010. Question 30. A patient is diagnosed with cardiac tamponade due to acute pericarditis. What is the correct sequence of ICD-10-CM codes? A. I30.1 I31.3. B. I31.3 I30.1. C. I30.8 I31.3. D. I31.3. Answer. A. I30.1 I31.3. This question tests the ICD-10-CM guidelines for reporting conditions where one condition causes another. The key is cardiac tamponade due to acute pericarditis. Acute pericarditis, I30.1, is the underlying cause and must be sequenced first, followed by the manifestation, cardiac tamponade, I31.3. This sequencing follows the ICD-10-CM rule for etiology followed by manifestation. If the documentation simply listed both conditions without a cause and effect link, the sequencing might be different. Remember to always look for linking terms like due to, with, or secondary to in the documentation to determine the correct sequencing order. Question 31. A physician performs a Holter monitoring for 24 hours, continuous recording, and provides the analysis, tracing, and report. What is the correct CPT code for this complete service? A. 93224. B. 93225. C. 93226. D. 93227. Answer. A. 93224. This question tests the CPT coding for the complete service of an electrocardiographic recording, Holter monitoring. The keyword is Holter monitoring for 24 hours, continuous recording, including analysis, tracing, and report. CPT code 93224 is the global code for the Holter monitoring service, which includes all three components: the professional interpretation/report, the technical setup/recording, and the scanning/analysis. If the physician only provided the interpretation and report, code 93227 would be used. The takeaway is that a global code like 93224 covers all aspects of the service provided by one physician or entity. Question 32. A patient with Marfan syndrome is noted to have a dissecting aneurysm of the thoracic aorta. What is the correct ICD-10-CM coding sequence? A. I71.01, Q87.4. B. I71.01. C. Q87.4 I71.01. D. I71.19, Q87.4. Answer. C. Q87.4 I71.01. This question tests the ICD-10-CM sequencing guidelines for congenital/syndrome-related conditions. The key is that the dissecting aneurysm is a manifestation of the underlying Marfan syndrome. According to the ICD-10-CM guidelines, when a current condition is a manifestation of a congenital or hereditary condition, Marfan syndrome, Q87.4, the code for the syndrome is typically sequenced first. Therefore, Q87.4 is primary, followed by I71.01 for the dissecting aneurysm of the thoracic aorta. If the documentation did not clearly link the two, the sequencing might be different, but the congenital link suggests this order. Question 33. A 55-year-old patient undergoes an initial placement of a temporary transvenous pacemaker in the hospital setting. What is the correct CPT code? A. 33206. B. 33210. C. 33216. D. 33211. Answer B. 33210. This question addresses the CPT coding for a temporary pacemaker insertion. The keywords are initial placement and temporary transvenous pacemaker. CPT code 33210 is specifically designated for the insertion of a temporary transvenous pacemaker system, electrode and generator. Codes 33206 and 33208 are for the insertion of a permanent pacemaker. For example, if the doctor performed the insertion into the right ventricle, 33210 would still be the correct code. Remember to differentiate between temporary and permanent pacemaker procedures, as they fall into distinct CPT code ranges. Question 34. A physician performs a complete pulmonary function test, PFT, with spirometry, diffusion capacity, and lung volume measurements. The test results are interpreted and reported. What is the correct CPT code for the complete service? A. 94010. B. 94060. C. 94729. D. 94726. Answer: C. 94729. This question tests CPT coding for comprehensive pulmonary function testing, PFT. The key is the documentation of a complete study, including spirometry, diffusion capacity, and lung volume measurements. CPT code 94729 is the comprehensive code for a complete PFT, which includes all the components listed. Spirometry is 94010, diffusion capacity is 94729's main component, and lung volume is 94726. The code 94729 represents the most thorough functional testing. If only spirometry were performed, 94010 would be correct. Always confirm that all components of a complete PFT are documented to justify using the comprehensive code 94729. Question 35. What is the ICD-10-CM code for a patient diagnosed with an unspecified pleural effusion? A. J90. B. R09.1. C. J86.9. D. J94.8. Answer: A. J90. This question tests the core ICD-10-CM code for a common respiratory condition, pleural effusion. The keyword is unspecified pleural effusion, which is the accumulation of fluid in the space surrounding the lungs, pleural space. The correct and specific ICD-10-CM code for unspecified pleural effusion is J90. Codes in the J94 category are for other conditions involving the pleura, and R09.1 is only for the symptom of pleurisy, pleuritic pain. If the documentation stated the effusion was due to a specific disease, a combination or secondary code would be required. The takeaway is to remember that J90 is the standard code for a simple, unexplained pleural effusion.